Hi there, Dr. Dennis Fiorini here, Fiorini Chiropractic Center, and I wanted to go ahead and actually we're going to start this webinar off here, uh, right here. There we go. Excuse me. So we're going to be watching and doing this spinal health care class for you. This is something that we do in the office a lot, but at the same time, I want to go over this so that you can go on to it on the web and you can watch it at your leisure. So this is our spinal health care class. I'm Dr. Dennis Fiorini, Fiorini Chiropractic Center here in Tallahassee, Florida. The big question when people are talking about healthcare is, why do people go to doctors? Why do they go there? Well, they go there for relief of symptoms. For instance, here's some advertisements that we've seen. So Vioxx provides 24-hour relief of arthritis pain and stiffness. Here's old John Elway to get rid of heartburn pain. They turn to Prevacid, so they're turning to something outside of the body to get the body to work the way it's supposed to. Allegra for allergies. We've got all kinds of things. How about Relpax for migraine? It says it's the latest in migraine medicine, and it relieves migraine pain and symptoms. Starts to work in as little as 30 minutes, and clinical studies prove that Relpax more people got relief with just one dose than taking Imitrex. Don't lose another day to migraine. Okay. Here's one about Strattera, which was for ADHD, and some people may be on this. And of course, here is the guys get to live without cramps now. We can too, so they're trying to appeal to the women. Here's Zyrtec for allergies. Here is, how about psoriasis, to treat psoriasis and its painful, stubborn symptoms. So we're trying to get relief of symptoms, but what is actually causing the problem? Are symptoms a sign of health, or are they a sign of sickness? For instance, what about vomiting? Vomiting, if you eat some bad pizza or something like that, vomiting is your body working the way that it's supposed to. If you eat something that is good for you, like an apple or something, and if you throw that up, then your body's not working the way it's supposed to. Okay? Symptoms can be very, very confusing. They can be misleading to you. And so what we want to make sure is we understand what's causing the problem and what can we do to get rid of it. What causes a headache? Well, pinched nerves, stress, right? Medications can cause them, squinting, vision problems, not enough food or water, menstrual cycles, tumors even. So if you relieve the headache with medication without figuring out what the underlying cause is, you could be doing your body more harm than good. Here's a pretty neat cartoon that I like. It said, I stopped taking the medicine because I prefer the original disease to the side effects, which is very timely right now. Serious side effects linked to many approved drugs. More than half of the prescription drugs approved by the Food and Drug Administration between 1976 and 1985 caused serious side effects that later caused the drugs to be either relabeled or removed from the market. This happens all the time, and you have to remember that every drug that's been taken off of the market by the FDA was once approved by the FDA. So that's something that we need to understand, and certainly something very timely. Drugs' ill effects often discovered many, many years later. Happens all the time. Here was a study from the Neuroimmunotherapeutics Research Foundation, Dr. Freudenberg. He found in a study that the chance of getting Alzheimer's disease is 10 times higher if an individual has had 5 consecutive flu shots, and that study was done years ago, between the years of 1970 and 1980, than if they had 1, 2, or no shots. So all of a sudden we're seeing some things that are related, not necessarily caused by, but at least related, and we need to really stand up and take notice. Many mainstream physicians are sending patients to chiropractors, to acupuncturists, and other practitioners of complementary medicine. That's happening now. Chiropractic is the second largest healthcare system in North America. So you being here is not surprising. You getting chiropractic care is not surprising. We're the second largest healthcare system in North America. But really, what is health? So health is defined as a condition of wholeness in which all the organs are functioning at 100% all of the time. That's from Webster's dictionary, okay? The tonsils. The tonsils are the body's first barrier against infection. When you get your tonsils taken out, you get more infections, more upper respiratory infections. The appendix, the latest research shows that that organ provides lubrication for the colon and possible protection against colon cancer, but it was once considered useless. So here we have, and each one of us has a God-given inborn wisdom or life. We have our heart, just exactly the right amount of times every day. Our lungs, breaths, exactly the amount that we need. If we start running around, our heart rate goes up, our breathing rate goes up. It's very understanding, and most people probably listening to this webinar know about how the body forms. We know that the two cells come together, they become one, and then they divide. And the first thing that gets formed is the nervous system, the brain and the spinal cord. And then all of these nerves start to form off of the brain and the spinal cord. And then at the end of these nerves, when we find out that that system is all put together, at the end of the nerves, then we start to develop different parts of our body. And so one area at the end of one nerve will develop a lung. At the end of another nerve, it'll develop the heart. Another nerve, probably a kidney or a liver. How about a liver? How about the kidney? How about the spleen? How about the stomach? All of these things start to form off of that central nervous system, because the central nervous system has to have a connection to everything. And then the body wants to protect it. So the only thing that's completely enclosed in bone is the central nervous system. So the brain is completely encased in a helmet-like bone called the skull. And then the spinal column forms around the spinal cord to protect it. And then we get ribs coming around to protect the vital organs in our body, and then our little baby is formed. So the four basic needs of life are these. Number 4, food. You have to have food. And a rule of thumb is man can live for about 21 days without eating. Number 3 is water. Water, you can only live maybe about 3 days without water. The second thing is, of course, oxygen. You can only live about 2 or 3 minutes without oxygen, but you cannot live even 1 second if your body is not expressing this nerve energy. If your brain is not sending information down to the rest of your body, you're brain dead. So it's very, very important to understand. Now, what's the medical profession saying about nerve energy? Richard Gerber, MD, a great author, he said the ultimate approach to healing will be to remove the abnormalities at the subtle energy level, which led to the manifestation of illness in the first place. Robert Becker, in his book, The Body Electric, said to understand health is to understand the central role of the brain in maintaining the resistance of the body. Dr. Robert Ornstein, you can look him up. He said health maintenance is the primary function of the brain. And so here we have what's called the autonomic nervous system, or the automatic nervous system is what I like to call it. And you can see the flow of energy from the brain out to the different parts of the body. And this is something that you don't have to think about. This is something that just happens automatically. And if there's any interruption in these nerve impulses, either by muscles, by pathologies, or by misalignment of vertebra, then you're going to have a malfunction of the body. Now, in his book, Chiropractic First, Dr. Terry Romberg, talks about a study in 1987 where they studied 1,250 babies 5 days after birth, and of that group, 211 suffered from vomiting, hyperactivity, and sleeplessness. And upon examination of them, about 95% of those children had spinal abnormalities, had something going on, had misalignments, maybe caused by the birth process. But after being adjusted, all the infants became quiet. The crying stopped, their muscles relaxed, and they went to sleep. And the same report said that they found over 1,000 infants with nerve interference in the upper neck area, which caused all sorts of clinical conditions, including central motor impairment to lowered resistance to infections, especially of the ears, nose, and throat. So, proper spinal alignment leads to proper nerve function, leads to functioning tissues, leads to good health. Whereas subluxation or misalignment causes nerve interference, malfunctioning tissues, and dis-ease, and then symptoms. Symptoms are the last thing to show up when something's going on in your body. So medical doctors typically work in the area of disease and symptoms, whereas where we are trying to make a difference is way up at the top of this flow chart. We want to remove those subtle misalignments that are causing the nerve interference, that's causing the tissue to malfunction, which causes the disease. So here's some study. Sudden deafness and the craniocervical junction, that's at the base of the skull, significantly reduced mobility in the upper cervical spine in patients suffering from sudden deafness. These results indicate a correlation between sudden deafness and functional pathology of that craniocervical junction right at the base of the spine. Pain that arises in the posterior arch of the atlas. That's where we work, right at the base of the skull. This was in the Journal of European Neurology. The author discussed his experience with 64 patients suffering from neck and head pain arising from the atlas, or C1, and he stated how amazed he was to realize the high incidence of that condition. The cervical spine is related to headaches. There's joints called apophyseal joints and other synovial joints that can become inflamed or subluxated, misaligned when involved by arthritic processes like osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, by trauma or by infection. Compression, listen now, this is the journal Neurology. Compression, irritation, or inflammation of the C2 sensory root or of its extension. So that's in the back part of you. If you go down the back part of your head into this little soft area that feels like a little gully on either side, the second nerve you come to is the C2 nerve root. The occipital nerves, compression of the occipital nerves with pain referred to the back of the head. So compression of those nerves can refer pain to the back of the head. Commonly believed not to exist, there is what's called a C1 sensory nerve root, which when stimulated produces pain in the orbitofrontal vertex region. So areas in the upper part of the spine can cause these types of headaches. Okay, I know I used a lot of big words in that. There was a case study back in 1994 in the Chiropractic Research Journal, effects of chiropractic on multiple sclerosis. The condition, which currently has no known cure, responded favorably to chiropractic care using an upper cervical approach to reduce a specific subluxation complex. There was changes in visual activity in patients receiving upper cervical specific chiropractic care. That was back in 1997. Cheryl Langley in 1994 described vertebral misalignments at the C1 upper part of the neck, which were related to epileptic seizures, bedwetting, and attention deficit disorder. Hyperthyroid conditions were also studied. They often responded very favorable to chiropractic treatment, and asthmatic children as well. So there's thousands and thousands of research studies that show chiropractic and how it can affect all of these other types of problems, even chronic constipation and psoriasis. How about the woman who went to the chiropractor and got pregnant? So I've had patients like this. We've had several patients who were not able to get pregnant, and after they were adjusted and we removed the misalignments, they were able to finally get pregnant. So are your nerves killing you? Henry Windsor, he was a medical doctor, he conducted an experiment on to determine whether there was a connection between the shape of the spine and the health of internal organs. So he did a series of 3 studies, and he dissected a total of 75 human cadavers and 22 cat cadavers. And what he found was that there was nearly 100% correlation between minor curvatures of the spine and diseases of the internal organs. So in this area, T1 through T5, there was heart disease and lung disease. In the area of T5 through T9, stomach diseases, liver disease, these areas that the nerves come out of this area and go out to these different organs, pancreatic disease even, and then spleen. So here we have a situation where the atlas is sitting level. That's at the top of you. You can see the top of the head. The atlas is level. The shoulders are level. And the hips are level. Now, when the atlas is misaligned or subluxated, this is what happens. So the head tilts, the shoulders tilt, and then one leg will look shorter than the other one. So it marches all the way down the spine. So this is another thing that I like. There's nothing wrong with the brakes. They were just applied too late. Who do you know that's waiting until it's too late? So we want to avoid waiting too late. We want to get to the bottom of the problem before there is a problem, right? Thomas Alva Edison said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame and diet and in the cause and prevention of disease. That's exactly what we do. So in our office, we utilize the Atlas orthogonal technique. It's a state-of-the-art percussion adjusting instrument. It's not sound wave, it's a percussion adjusting instrument. And our procedure offers patients a gentle and precise treatment for the correction of cervical misalignment. So here's the uniqueness of an Atlas subluxation. So let me orient you just a little bit. This is a picture of the base of the skull. As you're looking at it, the bottom of it is the back of the head. The front of it is the front of the head. We've got this big hole in the middle that's called the foramen magnum, or great opening. Right up underneath it is a bone called the atlas, and then up underneath the atlas is the second bone, or C2, or called the axis. Now this is normal alignment. That's when the atlas is normal, when it's sitting level. Now when the atlas misaligns, you can see that the central canal here closes down, and it causes the one shoulder to be higher than the other, and the one hip to be higher than the other one. So we do take 3-dimensional X-ray series. We take a picture from the side, we take a picture from the front, and then we take also an X-ray from on top. So we've got 3 dimensions, and now since I've put this program together, we actually take 2 more pictures, but these are the main ones. We want to be able to see the atlas and the cervical spine in 3 dimensions, and so this is the most accurate assessment right now. We are also looking into using CT scans as well, which will help us even more. So precise measurements are taken, and exact vectors, exact amount, how we're going to adjust this spine. We want to know exactly what angles we need to use to correct this misalignment. These vectors, or these angles, are put into our instrument. And so here's the percussion adjusting instrument. And the head is sitting on what's called the mastoid support. The instrument comes in here. We set the angles in and around the instrument. And then the adjustment is given just like that. It's painless, it's precise, and it's a percussion wave. So each one of these adjustments is tailored for each individual patient's misalignment. And so it minimizes discomfort while it maximizes the accuracy of the adjustment. So with increased accuracy, we look for you being able to hold your adjustment. You shouldn't have to have it adjusted every other week or every week, whatever, or every month. We believe that once it's staying in place for a period of time, we should be able to just check you 3 to 4 times a year after that. Some people can get to that, some people can't, but that's the goal of Atlas Orthogonal Care. So how long will you have to go to a chiropractor? It really depends on how badly your neck is sprained. Ligaments hold bones together, and stretched or sprained ligaments always remain stretched, and they leave the joints of your neck weak. It allows the vertebra to misalign. So you're not through with chiropractic care until the range of motion of your spinal vertebra are restored and your spinal misalignments stay in place. Okay, we want to keep them in place. So when the range of motion of your spinal joints are not restored to normal, spinal degeneration and arthritis is what follows. So it's very necessary to follow up. You've heard people say, once you go to a chiropractor, you'll always have to go to a chiropractor. And that's true as long as you have a body, you'll need an MD. As long as you have teeth, you'll need a dentist. As long as you have a spine, you'll need a chiropractor. So periodic chiropractic care is necessary to keep that spine aligned. So at this point, you can contact us with any questions that you may have. Thank you for watching. We like having these seminars online so that you can see what's going on and know what we're trying to do with your spine. And so we hope that was informative for you, and we hope that you will continue to do well with your health. And when you need somebody to help you with your health, please give us a call. Have a great day.